Hello, this is Dr. Kevin Huffman from Medical Travel Associates. In this tutorial, we will discuss the continuum of care for the medical or surgical traveling patient. Now, if you're traveling for surgery, what you have to understand is there's an interruption of your continuum of care. In continuum of care, what we mean is somebody takes care of you from the moment you decide to have surgery until your surgery is over and then in your recovery phase. Now, typically, what we do as primary care physicians is we deliver that care here in the States. So say, for example, you come to Orlando, Florida, and you have your surgery here. I may take care of you prior to surgery, make sure that all the lab work's done, that you're physically fit for surgery, that everything we need is in place to ensure that you're going to get the best outcomes. But after surgery, you'll be seen in the hospital typically by hospitalists. That is a team of specialized physicians that will treat you during the acute recovery phase. And there may be 2 or 3 days that you're in the hospital. When you're discharged, you're either discharged to the surgical team who follows up with you or to your primary care physician. In any case, you're having continuous care. There's no interruption of care. The importance is this: if there's interruption of care, there's a potential risk. Something can go wrong. We may miss some sort of complication that could have been easily addressed because we didn't catch it early. And that's the risk you have with medical travel. If you travel to a distant location and you come back to your home, who's caring for you? Is there a surgical team here? Is there a hospitalist here? A trained physician willing to treat you? In many cases, there's not. So what we do through Medical Travel Associates is work with your primary care physician, your personal physician, to help him or her understand their role in pre-operative, pre-travel health care to get you ready, fit for the flight, fit for the surgery, and then post-travel, post-operative care. So when you come back, whether you're coming back domestically, that is, you live in Detroit and you went to Houston, you're coming back to Detroit, or you live in Orlando and you're going to Costa Rica. Wherever you're traveling to, when you get back, it's critical that somebody is there meeting you, understands the surgery you had, the operative reports, they see those operative reports, they have communication with that surgeon, and they understand the discharge orders. They understand what that orthopedic surgeon or bariatric surgeon from Mexico or India or Costa Rica wants, so that this physician can implement those treatments. So our specialty is working with primary care physicians. We open lines of communications. We travel all over the world to meet with physicians, surgeons, and hospitals. So we understand what they're doing, and we understand we now have communication with these folks. We get in the middle and communicate with that surgeon and deliver messages to your primary care physician. Now, your primary care physician has direct lines of communication as well, but many of them are so busy they just don't have time to be calling India or calling Costa Rica and talking to a physician that may have a different language. So we take care of that for the primary care physician. But it's very critical. What we've seen in terms of medical tourism, where things have gone wrong, it's not so much the surgery. Occasionally a surgery does go wrong. Sometimes it's inevitable. It's just a risky surgery and it would have went wrong here in the States. Other times it went wrong because you as a patient or a self-insured employer or an insurer didn't vet out that hospital or surgeon well enough. You didn't understand what their complication rates or infection rates were, and you didn't know how many cases they did and how frequently they do cases. And we do that. We do that ourselves. We vet them out. We understand how many cases they do, what their complication rates are. We talk to the surgeon. We look at their data. So there's nothing that can be hid or hidden from us. We then initiate this continuum of care. The worst thing you can do is say, well, I'm going to fly to Mexico and have a lap band surgery. And you don't tell anybody in your medical community. Well, first off, you may fly down there and not have the surgery at all because you show up with some sort of medical risk that they won't do the surgery. Maybe you have an elevated blood pressure that could have been checked in your physician's office, or a fever of unknown origin. These are things that we train your physician to look for. Make sure that you're safe to go down there. Second, we want to know when you're having surgery. We want to be there with you. If we're not there physically, we're going to be there virtually. We want to know when you're in the operating room, when you get to the recovery area, when you go to the general floor, and when you're discharged to your long-term recovery whether that's in a hotel or an extended care facility in the destination location, domestically in the U.S. or internationally. So we watch every step of the way. We know what's going on. We start pulling in those medical records, the surgical reports, the discharge summaries, what the doctor wants you to do in terms of long-term recovery. And then we go back to your primary care physician, and again, we engage that physician, teach that physician, monitor that physician to make sure that you're getting the best possible outcome you can. This is all about getting good outcome. It doesn't matter if you're saving $1,000 if you get $10,000 worth of complications or you die from the surgery. So we want you to find good value for your dollar, and that may be traveling just across the state, or it may be traveling somewhere within the state to another state in the United States, or it may be you're going to India or Mexico or Costa Rica or Middle East. But wherever you go, we want you to contact us at 866-270-5116 and let our team of physicians and nurses work with you and your physician and your destination surgeon to ensure that you get the best outcome. So contact us anytime, 866-270-5116, and we'll help your physician integrate a continuum of care for your medical travel. Thank you.